Commissioner Justin Rodriguez. We're joined tonight by Chief of Epidemiology, Dr. Rita Espinoza, and this is our COVID-19 update for the San Antonio community. Tonight's weekly vaccination report shows that 928,327 people have received at least one dose of the COVID-19 vaccine in our community, and 647,489 people are fully vaccinated. This means we now have 61.6% of our population that has had at least one dose, and 43% of the eligible population are fully vaccinated. So that's great news. We want to thank our partners over at the VA and the DoD for contributing to those numbers as well. As a reminder, everyone 16 years of age or older can receive a COVID-19 vaccine all day at the Alamo Dome drive-through clinic without an appointment. That's Tuesdays through Saturdays, 9 a.m. to 6:30 p.m. Of course, if you prefer an appointment, we can still sign you up. We have thousands of appointments available at the Alamo Dome Clinic, and just visit covid19.sanantonio.gov or call 311 to register for one of those appointments. Now on to our COVID infection update. We're reporting 189 new cases of COVID-19 today. That brings our total to 219,008. Our 7-day rolling average is now 205. You can help us fight this pandemic by getting vaccinated and also by wearing a mask until you do so, as we continue to get these vaccines into the arms of our members of our community. Sadly, we do have 4 new deaths to report today. Again, we have lost far too many of our neighbors and loved ones in this pandemic, so please keep their loved ones in your thoughts and prayers this evening. Over in our hospitals, there are 219 COVID-19 patients tonight, and there were 32 new admissions in the last 24 hours. 71 patients are in the ICU with COVID-19, and 41 are on ventilators. Let me turn it now to Commissioner Rodriguez.
Great. Thank you, Mayor, and good evening, everybody. A couple of updates with respect to vaccination sites this evening. And this is a push to try and get vaccinations closer to the people, closer to neighborhoods. University Health has been doing a great job, as has Metro Health. One of the vaccination sites that UH has been operating here over the last few weeks is over at St. Philip's. That site will be winding down over the next few weeks. I think May 19th will be the last day. And we want to thank Dr. Flores, Mike Flores, and all of the Alamo College's Board of Trustees for their partnership. But in an attempt to get, again, closer to the neighborhoods, there's a couple of clinics that are pharmacies, rather, that UH is operating. And there's 4 locations: the Texas Diabetes Institute on Zarzamora, the 36th Street Clinic, University Health Ada Street Clinic, and, of course, the Robert B. Greene. All 4 of those are now available for vaccinations 8 a.m. to 5 p.m. Monday through Friday. The Robert B. Greene is actually also open on Saturdays 8 to 5. No appointment necessary. You can just walk in, and we want to encourage everybody to continue to push to get their friends, themselves, and their neighbors vaccinated. Another quick announcement with respect to the Freeman Coliseum and the housing of the migrant children there, unaccompanied minors. We did want to let folks know we received a report earlier today. Sounds like a scam. People are asking for toiletries, asking folks to Venmo, send money. We verified with HHS over there at Freeman that is not something they are doing. They've got plenty of toiletries and supplies for the young men over there. So please, just a PSA, do not respond to anything you see that shows they need resources there, asking you to send money. That's not something that is being done by the folks at the Freeman. Lastly, Mayor, I don't know if it's coincidental or poetic. This happens to be the Happy Nurses Week as well as Teacher Appreciation Week. And when you think about the folks that have really had the impact on the front lines over the last 12 to 15 months, those are 2 groups that we need to thank, not just this week, but it happens to be coinciding that they're both being appreciated and thanked this week. So we want to thank all the nurses on the front lines, not just what you've done over the last year, but certainly day to day, even to this point. And then, of course, our teachers who have kept our kids safe, kept them educated, and we cannot repay you and thank you enough for your commitment. So thank you, teachers, and thank you, nurses.
Yeah, very well said. Thank you, Commissioner, for bringing that. And noting that, we also want to say that if we want to help our teachers out, the best thing we can do is get folks vaccinated as quickly as possible. But thank you again to our teachers in our community, as well as the nurses who have been battling on the front lines of this pandemic for over a year. Now it's time for our frequently asked question that comes into Metro Health. I'm going to pose this one to Dr. Espinoza, and the question is, do I need insurance to get a COVID-19 vaccine?
No, the federal government has made the vaccine available to everybody and has covered that cost. So individuals should go get vaccinated. There's no charge if you have, regardless if you have insurance or you do not have insurance. So we're strongly encourage everybody to go get vaccinated. Cost should not be an issue at all.
Great. And I also want to note that it doesn't cost any money for you to go get a vaccine as well. These are free vaccines that we're providing at the public health clinic, so please go get yours as quickly as you possibly can. Also want to remind you, if you've been struggling through this pandemic, the county and the city have been working together to help you with rent or mortgage. If you need access to that program, you can call 311 or visit covid19.sanantonio.gov. Also, if you're out of work and without income and would like to train for a job that's available today in our community while we receive a stipend to make ends meet, simply call 311 for more information on our Train for Jobs program. Finally, thank you very much for everyone who's been working so hard throughout this pandemic, whether you're on the front lines or you're just a neighbor helping another neighbor by wearing a mask and practice social distancing or getting your vaccine. We want to thank you for all the work. We're heading in the right direction. Let's keep it up. As a community, do it for yourself, do it for your family, and do it for San Antonio. With that, the Commissioner, myself, and Dr. Espinoza are available for questions.
Mayor, you mentioned that over 60% of the eligible population has at least one COVID-19 vaccine. This week, the Fiesta calendar was released. Is there any concern about this, the pandemic and Fiesta, or has that plan been talked over enough that you feel safe about it?
I feel good about it, in particular because our Metro Health public health professionals have been working with the Fiesta Commission to ensure that the proper protocols are in place depending on what the conditions are. And so you'll be hearing more about that as we get closer to Fiesta. But again, these are well-coordinated events, and because of the level of vaccines that have been administered so far in the community, what we expect, as well as the level of transmission that has really come down significantly, we feel good about conducting a safe Fiesta. That being said, it's going to be a little bit different than Fiestas of past, at least for this year. People can expect to be required to wear masks at the events, etc. But all that being said, those minor conveniences are well worth a Fiesta that everybody's been wanting for quite some time.
Will there be citations in regards if people are not wearing their masks when they're asked to, or citations in general regarding COVID-19?
So each of these Fiesta events are hosted by member organizations, part of the Fiesta Commission, so we're going to be relying on them to enforce, and that because almost all of these events are paid events, will result in an ejection if people are not complying and keeping themselves and their families and neighbors safe as they participate in Fiesta. So we just want everybody to have a good time, a safe time. We can do that if we do, again, the simple precautions of keeping people safe, knowing that we are finally putting an end to this pandemic, but we're not quite there. We're almost there, and people should note that as they celebrate Fiesta.
And just to be clear, at all these events, you're saying masks are going to be required?
Yes, that's one of the conditions that we've been working with the Fiesta Commission on. And so official Fiesta events are sponsored, coordinated by the Fiesta Commission. So they have expectations and conditions they can place upon those events.
Is there a plan for any unused vaccines, and could you tell us how many vaccines have been lost or unusable so far?
So, and it depends on where you're looking at, which vaccine. So at the Alamo Dome, we take a lot of precautions, as well as all of the other mass vaccination clinics, to make sure that we're not wasting anything. So we're making sure that we're opening vials, putting them at the temperature and keeping them at the right temperature for the appropriate times. And then we also work very collaborative with those partners so that if anybody for some reason has vaccine that's been kept at room temperature and needs to be used up in a short amount of time, we transfer it to other entities that can use it so that we minimize any kind of loss. And that's really the strategy that we've been using here in Bexar County. If anybody is coming into an issue and we don't find a provider within Bexar County, we can always work with the state to transfer that vaccine to other locations so that we don't lose any vaccine. If you look at the Alamo Dome, overall vaccine loss has been, I believe, like 0.1% of all the vaccines that have been administered there. And I don't know, Commissioner Rodriguez, if you know anything about UHS or...
No, I think the same thing, Rita. Yeah, I've not heard of any specific numbers with respect to unused vaccines, but I will tell you, I think part of the shift in going, particularly with University Health, going to the clinic or pharmacy model is that they have all of the equipment there to make sure proper temperatures and things of that nature, and so that vaccine doses aren't wasted.
There are more and more outdoor events taking place, and Fiesta is on the way. Does the recent CDC guidance help provide some peace of mind to public officials, knowing that the risk of outdoor transmission has been proved to be very low?
It certainly does for me. I mean, we are thankful that at least for the recent few months, we've had a coherent national approach and good guidance from the CDC, and you can rest assured that we'll be following that guidance to keep our community safe as we conduct these events. But again, credit to the San Antonio community for taking the proper precautions even when the messages were mixed. We have seen now a sub 3% positivity rate for almost 2 months. It's been the lowest in the state of Texas for quite some time. We are on the leading edge of administering vaccines, so we're doing everything that we need to do as a community to put an end to this pandemic. We want to make sure that we continue to do that as we enjoy the events that we've been waiting for.
And just a word of caution, I mean, that's another reason we want people to get vaccinated, because there's even more protection if you're vaccinated. If you look at the CDC guidelines, even if you're in mass crowds outdoors, it still recommends the mask. It really provides some leniency if you're doing things within your family or alone, bicycling, hiking, walking, to not have to use the mask. But if you're going to still be in a situation where there's a lot of individuals and crowded, then the mask is still the safest route.
And let me add one other thing. The single best thing we can do as a community to ensure our economy comes back robustly is to ensure schools can open on time healthfully in the fall. And if we can get people vaccinated, we get as much of the vaccines administered as possible, we continue to see the transmission rate plummet, that will happen. And so, again, it's Teachers Week, Teachers Appreciation Week. The best thing we can do for our entire community economically, healthfully, to recognize the work of the healthcare workers and the teachers is to get folks vaccinated and see our schools open up safely and on time this year.
And Mary, as you make that appeal, as I look at these numbers, there's that segment of 18 to 49-year-olds that are the lowest number of vaccinated in our community. I think, everyone else is in the 60% range, or at least 40% plus with one dose. Our 18 to 49-year-old group is maybe 43% with one dose and only 28% with two. I know that's an age that I think some of us are in up here, and you tend to think you're indestructible and you're young and healthy, but really we need to appeal to those folks as well, that it helps the entire community if we all get vaccinated. So that age group, if you're in that 18 to 49-year-old age group, please, weeks ago you couldn't get a vaccine. Now you can walk up virtually anywhere across the city and county and get your vaccination. So particularly if you want to have a safe, fun fiesta, as the mayor mentioned, you want to go back to school with some degree of normalcy in August, we need to make sure we push that. So please, that's an appeal I think we all echo.
How has traffic been at the Alamo Dome drive-in vaccination clinic, and will that site remain open for the foreseeable future?
Well, there has been traffic. I mean, there have been individuals. We're still been given about between 2,000 to 2,500 doses a day at the facility. I think we're looking, as everybody else, is how long do we need to keep that open, as far as how feasible it is, and looking at the manpower. I don't know if Mayor, if you want to say how long it might be.
Yeah, I mean, it will remain open at least for the foreseeable future. Now, there may be some times that are staggered as we see, the traffic drop off, and as the traffic at pharmacies and doctors' offices go up. What we have talked about, though, is ensuring that there is always a mass vaccination site available to our community at any time. So we'll be working with UHS and with UT Health and WellMed and the folks at the Alamo Dome to ensure that that remains the case. But and again, I think that's to underscore the commissioner's point. It is extremely convenient right now to go get a vaccine. We've got plenty of supply. That may change. The convenience factor may change if some of the facilities start to shift their operating hours, or as we expect within the next days or weeks, younger people are eligible. That may cause a little bit more of a wait time for you to get your vaccine. So if you've been just kind of putting it off and are interested in getting a vaccine, go get it immediately.
Do we have updated case totals for variant cases of concern? And could you tell us the latest local figure of breakthrough cases and whether any have resulted in hospitalization or death?
So as far as the variants, we're still seeing predominantly the B117. I don't have the exact numbers of how many have been reported to us, but that is still the predominant strain that's been identified. With vaccine breakthrough cases, we're actually going to be analyzing some of that data over the next couple of weeks and should have more information. From what we have seen so far of the breakthrough cases, they have not required hospitalization. It's usually been a milder illness in those individuals. And typically they had household contacts that had contracted the illness, and that's where their exposure had occurred.
As the demand for vaccines slows, are there concerns that some of the vaccines will expire?
There's always the concern that the vaccine would expire, but that's why we watch closely for those expiration dates, and we try to ensure that the vaccines are kept at the appropriate temperatures, so that way they don't have to be used up so quickly, and making sure that the vaccine is used judiciously as well.
That's all the questions we have tonight. Thank you.
All right. Thank you.
It was just one question.